Good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. And I want to thank you for joining me this afternoon for our Facebook Live interview. Today, I'm going to be bringing on Dr. Steinke, our CEO here at CGH, to answer some questions. But before I get to Dr. Steinke, I just want to first of all say that as we've kind of posted about this interview that we'll be doing, I know we've had a lot of good conversation online, questions and comments and concerns and praises and all those kind of things regarding what's going on right now at our hospital with Omicron. And so we're going to continue to have that online presence. I also want to give a shout out to Dr. Coons and Christy Gaio. I know they've done a really nice job, along with our marketing staff, of trying to answer your questions and the things that come up on Facebook. So thank you to our marketing team and Dr. Coons and Christy for that. So because we have a lot of ground to cover today with Dr. Steinke, we'll probably won't have viewer questions. If we do, we might have a few if time allows at the very end. But like I said, we will continue to have an online presence where we'll continue to answer your questions. And our goal in this broadcast, as all of our broadcasts, has been to keep you up to date with what's going on in our community from our perspective and at the hospital here during this pandemic, and to be transparent about that information so that our community is informed and aware and educated. So I do want to show a couple graphs. Matt, if you'll put up a couple points on this. This is from December 31st, 2021. And the reason we don't have more recent ones is they're transitioning to having the state begin to do those tests. And really at this point in time, the number of cases isn't as significant as the number of people in hospital beds. So I think that the health department, Illinois Department of Public Health, is transitioning in terms of the information and how they share it. They will continue to share information. It'll just be in a different format. And you see the positivity rate there. I think that's interesting. So on December 31st, the positivity rate was, give or take, 7.5%, 8%. And you look now and you look at different sources here in our region, and it tends to be more in that 17 to 18% range. So it's really gone up. And case count wise, the other thing is with these home tests that are happening now, these are just the official case counts. It doesn't include folks who are doing home tests or who have symptoms and are just staying at home. So I think that's part of why the health department is backing away from quite as much of that day to day. And then the other one I wanted to show you, Matt, if you would. Yeah, this is just Omicron and Delta and others. And so Omicron is purple and Delta is whatever that color is. Let's call it orange. And then the others. And you can see this is the trend over the course of the last month or so. And the last column is, I think that's January 1st of 2022. And you can see that Omicron in our region, which is basically upper Midwest, is, 95-ish%. And it's probably closer to 100 now. We're a week into that or close to a week into that. So, I just want to give you a sense of, by and large, right now, this is an Omicron situation where it was Delta, where it was, I don't know, Alpha. I lose track of all the variants, but that's where we're at right now. Okay, enough of me going on about that. I'm really happy today to have an opportunity to have Dr. Steinke to be on the call with me. So I'm going to pull him into the call right now. Hey, hi, Dr. Steinke.
Hello,
good to have you.
Nice to be with everybody today.
Yeah. You know that we have some interesting things going on with the variant when we pull Dr. Steinke in just to kind of talk about that. So we're glad to have you. Are you ready to answer a few questions?
Sure. We can start with the format and see where it leads us.
All right. Okay. So just from your perspective, what are you hearing from our region and state beyond what I just talked about a few seconds ago?
Yeah, sure. So a little bit of background perspective, I think, is helpful on this. Obviously, those of us who are working in it, we immerse ourselves in the data and get updates on a daily basis on all of this. I think as we're entering month number 21 or 22 of the pandemic, we're all tired of this. We are all tired of it. And I think to the extent where we are able to live our regular lives without much impedance. I think we're all wanting to get back to that point. So within that context, as we've heard about COVID ups and downs, Omicron really didn't begin to reveal itself until just after Thanksgiving. And it's much as we predicted and as they were telling us, and what you and I both learned in medical school, Bill, was as these viruses mutate, especially respiratory viruses, they tend to become more contagious, but thankfully generally less deadly. We've been a little bit insulated in our region and around the state of Illinois. We are technically in the slide you showed, that we're in region 5 from an HHS perspective, but within Illinois, we're in region 1, and that includes all the Rockford hospitals, Freeport, DeKalb, KSB in Dixon. So we kind of get a sense of what the pandemic is doing around us. And we have felt somewhat lucky and blessed as we were hearing stories in Rockford and Freeport and other places of extremely high volumes as Omicron took off and their hospitals filled up. We were sort of treading water and not seeing those kind of changes. Well, just in the last week or two, we've seen things change for us really more dramatically, with more numbers coming in, our ER filling up, and so we've begun to see some of the same things that are happening within our region and around the state. So we are sampling firsthand what Omicron and the current things going on within the pandemic are doing.
Yeah. So how would you say that this particular wave or variant, how is it different this time than previous ones that we've had, would you say, Paul?
Sure. Our first case was back to March of 20, which seems like a lifetime ago at this point.
Yeah, it does.
We really saw our crazy numbers about a year ago, late November, early December. So I'm talking about November, December of 20. At that time, we were still working through having enough PPE, the protective equipment to keep our employees safe in terms of masking and gowns and all the rest. We were working on treatment modalities. We didn't have a lot of treatment options at that time. So there was a time, I think our hospital had 43 inpatients. I think that was our peak.
We didn't have a vaccine either at that time.
No vaccine, no treatments. We were really just doing the best we could to take care of people. Flash forward to now. Thankfully, our PPE supply is steady and dependable. What's different now is that our staffing is a bigger challenge. Across the country, employees are dropping out of the workforce, and healthcare is no exception. I've read articles where as high as 20% of healthcare workers are dropping out of the field forever. So you couple that with a workforce that is, for various reasons, said, I'm going to sit this one out. Our work shortage is probably the biggest play here. The other thing that's happened as other places around us have filled up, we pride ourselves on being a good, reliable, but small community hospital, and we like to take good care of the patients that come to us always. We know that there are things that we don't do. We don't do open heart surgery and very complicated things. And in the past, we've always relied on the ability to transfer patients out when needed. As the Omicron has come into being, transferring patients has become more and more difficult. So between the shortages in our workers and our inability to transfer a lot of folks out of here, that's presented itself with some new challenges.
Yeah, it seems to me too, like compared to that November, December of 2020, just because this variant is more transmissible, it seems like we have more of our workers on isolation or quarantine too, which pulls even more folks out of the pool to be able to help take care of patients.
So, and to that point, here's the good side of this time around with Omicron. Vaccinations are proving their worth. They are not perfect by any means. But if I ever had any questions about whether the vaccines were effective before, we had to rely on the information given to us at the time when the vaccines first came out. We had to trust that the information they were giving us was solid, and to a degree, it's proven itself out within the hospital right now. And we'll get to it. I know a few more questions here, but we see a very distinct difference in the folks in our community that have been vaccinated and boosted, and how they are doing with COVID versus those that have chosen not to get vaccinated. And I don't want to spend time shaming or berating anybody for the decision that they've made to not get vaccinated. That's really up to those individuals. But what I can tell you is that in practice, and what we are seeing on a day-to-day basis, is a huge difference in those that have been vaccinated and those that have not.
Yeah. Good point. So, right now we're doing okay. We're getting by, but can you kind of talk a little bit, Paul, about some contingencies that you've been thinking about if we do have more of numbers and stuff like that here at the hospital?
Yeah. So our priority always is take care of the sickest and making sure that we have capacity to do that. And that includes having space for them, having our needed nurses and respiratory therapists and lab people and all the folks that make that happen, making sure we have enough people to meet that demand. What we've seen in other hospitals in Region 1 up in Rockford, they've stopped doing elective procedures and surgeries. They've cut back on all the other non-COVID related work that they do to the extent that they can. And that's helped them free up beds and free up people to take care of the COVID sick. We thankfully are not there yet, but what we do is we do plan for those contingencies. So part of that planning and part of that discussion is if the need continues and the demand continues to proceed the way it has in the last week or so, we may come to a point where we start to cut back on our elective surgeries, cut back on our elective labs and imaging, and free up some space to admit more people, free up some people to take care of them. So again, we're not there yet, but those are things that are right around the corner if things continue the way that they are.
Yeah. So I'm sure some of the folks who are watching us, Paul, or will watch us, are wondering, hey, we're as citizens, as community members in the communities that we serve, how can they help our CGH healthcare team?
Well, I think that the important takeaway is we are living through the transition of this being a pandemic and it becoming more endemic, which means that it's something that is just moving and mixing amongst the population, much like the common cold is, or much like the seasonal influenza is. Now, I'm not saying that COVID is just like influenza, but I think back to 2009 when we had H1N1. H1N1, it killed some folks, as influenza does every year, but H1N1 was a particularly bad year. So I guess my approach to this is to try to challenge people to think about this from a common sense approach. The way you can help us and help the community is also a way that you can help yourself. Right now, we, and again, we'll get to this, but our ability to test people is strained and limited. Our ability to see everyone with COVID is strained and limited.
Yeah, so I'm going to interrupt you there, Paul.
Yeah.
So let's get to that. So,
Okay.
You and I've talked about this a little bit. What are your thoughts on the idea of someone who has mild, moderate, or really significant symptoms for COVID, and how they would go about interfacing or not interfacing with CGH and healthcare community?
Sure. And this is a little bit of a change. And let me start this conversation by saying, if you are sick and you think that this is developing into something moderate or severe for you, significant, we want to see you. I don't ever want anybody to feel like that we are not there for them. We are here to help you out. What we are finding, though, is that Omicron it's on a spectrum. You can pretty much assume if you're otherwise young and healthy and you wake up with cold-like symptoms, so a runny nose, a postnasal drainage, a cough, maybe a low-grade fever and a headaches and fatigue. If your symptoms are relatively mild, I think you treat this like you would any other viral infection. You stay home, you push some fluids, you stay away from other people, try not to get anybody else sick. If you have the possibility of getting tested and you want to know, or you need to know because of your employer, or you need to know because of your household contacts or people going to school, I understand wanting to know. But if you've got really mild symptoms, there's really nothing we're going to tell you beyond go home, get some rest, push the fluids, and do all the things that you know how to do. All the things that mom used to do to take care of you, chicken soup and all the rest. Because there may not be a test for you, or if there is a test, you may be waiting a long time for it. The best thing to do, and again, I want to preface this with, if you have moderate or significant symptoms, we do want to see people. But what's happening right now is that we often will have entire families will show up to the ER. And they all have mild symptoms. And I understand they want to know. They had some exposure at a family gathering, and they want to know if the family is sick. I get that. But what happens is in the ER, we have people that are, in some instances, are trying to die. And so we have staff that are doing their very best. They're very diligent and trying to save people that are at that point. And it may be due to COVID or something else. But if you're out there with the rest of your family and you're wondering why it's taking 6 or 8 hours to get in for a test, that's what's happening. Mm. And so, again, I'm not telling folks that we don't want to see them, but if you've got mild symptoms, maybe ask yourself, is this something I really need to know? Because you can probably assume it's most likely COVID.
Let me segue to something else. So let's talk about, like, if you have mild, maybe moderate symptoms, you don't feel like you need to go to the emergency department. So we do have what's called Ready Care here for folks who do want to have someone take a look at them. Can you talk a little bit about what we've done, Paul, to make that more robust, and how we're ramping that up?
Yeah. So if again, I wake up tomorrow morning, I'm going to knock on wood and hope this doesn't happen. But if I have mild symptoms, I'm going to ask myself, do I feel like I'm doing fine with things? Can I go to bed? Can I rest and give myself a few days and things may be better? If it gets to the point where I say, you know what, this is starting to concern me a little bit. My cough is becoming more productive. I'm a little bit afraid where this is going, and I think I need to be evaluated. So I'm not sick enough to say I'm starting to wonder if this is life-threatening. I can't breathe. I need oxygen. I need intense care. That would be something to go to the ER. So I'm in that middle ground, and I call Ready Care, because Ready Care, they've been doing this a long time. They can almost look at somebody at this point and say, yeah, that's probably COVID. Now, that's not what they do down there. They test. But you call Ready Care. Now, they have limited capacity as well. But what we've done in the last week or two is to expand their reach and open up more opportunities for people to be seen. Ready Care has a limited space with limited people. And so, again, Ready Care will direct this, but we've opened up opportunities for people to be seen at the clinic in Rock Falls, at our clinic down in Walnut, over in Morrison and in Fulton and up north in Mount Carroll. Again, we are asking you to get a hold of Ready Care first, but they may direct you to some of these other places to be seen if they feel that that's indicated and they're not able to accommodate that right away.
And those other places are able to test as well.
Absolutely, yes.
Yeah, great. So I'm going to have our marketing folks put up the number up there just so folks can see that.
I do want to say something more about this, Bill.
Yeah, fire away.
Yeah, we also have, and I understand this too, we have a lot of people that they really don't feel like they need to be seen. They just want to get tested.
Yep.
And we are asking people at this point not to go to Ready Care if all you're looking for is a test.
Okay.
So you might be symptomatic, you might have had an exposure, and you feel like you need to be tested. I understand that. But Ready Care is really the venue to be assessed by a nurse practitioner. Is this something that's moderately severe? does it require an inhaler, for instance? There are some other medications that can be given on an outpatient basis, not in the hospital, that might help you feel better at home. In which case it makes sense to be seen and evaluated and tested. But if all you're seeking is a test, we're trying to direct people to those testing centers. So that might be Whiteside County Health Department has saliva testing. There's some other places around town as well.
Good. Thanks, Paul. That's a good point to make. And for those of you also who are seeing the screen on the bottom left, there is a link that we have. If you go to our website, there we go. So that's if you want to find out more information about where the potential testing opportunities are, that will lead you in that direction. So, okay, good. Yeah, we've covered some good ground, but I have a few more things I want to talk about. Let's see here. Oh, I think it's worth talking about. So one of the reasons the health department, I think, is backing away from just doing a daily case count is so many tests are done at home, these antigen tests. Let's talk a little bit about that, Paul. What's your understanding of those tests right now?
Well, probably most important, significant understanding is they're not available.
Yeah, this is true. Unless you already got, yeah.
I think that right now, our local pharmacies, and they're struggling to get some more supplies in. But my best understanding right now is that they're hard to find. But hopefully that situation will be remedied soon. But unlike the tests that are done through the health department or other places, or the tests that are done at CGH, are what we call PCR tests, and that is your most reliable test that you can get. Most of the over-the-counter tests are antigen testing. So, Bill, you can talk about we always talk in medicine about false positives and false negatives. How often can you believe the results? So
right. Yeah, so right now on those antigen tests, if you're positive on that test and you have symptoms, I'd go with it. I'd go with it. I'm positive. If you, number one, if you have symptoms and you test negative, I wouldn't count on it. So the negative tests are a little problematic right now. I just read something before we came online, Paul, where they're saying that it could be, I think, 3 or 4 days, the lag between when you start to shed the virus and when it actually shows up on that antigen test. So particularly for those folks who don't have any symptoms and are using that antigen test as a means to know whether or not they potentially have COVID or not, I wouldn't count on it for that purpose. And if you're going to do anything, if you have the tests, I would probably do one. And if it's negative, and you're really concerned, you might wait a couple more days and do it again, just to make sure that you're, to be more sure that you're truly negative. So for what that's worth, I didn't want to beat a dead horse, but I do think it's worth talking about when we're talking about testing.
And the most important thing that you said there is that an antigen test is actually testing your body's immune reaction. And so it takes a couple days for that immune reaction.
Did I say that?
The antigen test.
You're giving me credit for more than I said, but I'll take it.
That's what you said. So when you're doing a PCR test, you're actually looking for little strands of RNA that are in the virus itself. When you're doing an antigen test, you're testing the body's reaction to the infection, which is why it takes a couple days for it to turn positive. So that's the important thing to remember.
Yeah, good. Okay, I wanted a segue to another to the treatment side a little, just briefly. So what's the status of monoclonal antibodies? The IV therapy here at CGH, Paul?
Yeah. So as I said, the difference between a year ago or so, 13 months ago, and now is that we do have the monoclonal antibodies. So again, these are antibodies that are grown in a lab that help attack the infection. It gives a boost to your immune function when you have the infection. What has changed a little bit with Omicron is that those antibodies are not as effective as they once were. So that is changing a little bit of our treatment. There is a new monoclonal antibody that, in fact, we just got our first shipment earlier this week. But those supplies are limited, but thankfully they are available. So that's what's changed about the monoclonal antibody infusions. And what on the horizon are the oral medications. Maybe you want to speak to that a little bit, Bill.
Well, one more thing on the monoclonals first, Paul, would just be that I think our ask for the folks that are listening is, once again, because our supply isn't quite as plentiful, it wasn't as plentiful as it was before. Obviously, if you have risk factors, those risk factors being you're over the age of 65, you have some type of chronic medical condition, and particularly if you're unvaccinated, you kind of fall in that your higher risk bucket. On top of that, though, we also, if you have those risk factors, but you otherwise just have mild cold symptoms, you're probably not the perfect person that we're wanting to get those monoclonal antibodies to, because we're wanting to get those to folks who are really starting to feel pretty poorly. So just as you have conversations with your PCP, that may be part of the conversation. Will be not just, okay, yep, you are definitely a high risk person. How do you feel? Because that's going to play into, at least right now, as we have not as plentiful of supplies we've had in the past, that may be part of the conversation. Anything else about that, Paul?
No, yeah, that's just where we're at. I think it's easy to be critical of the drug companies, which I am too, but I'm happy that there are things in the pipeline that are working. And so it's just a matter of having the technology catch up to our needs.
Yeah. Okay. Now the oral medicines. What are your thoughts on those, Paul?
Well, again, it's nice to have more tools in the bag to try to help people through this. And once those become more plentiful, I think they are showing good promise. I know that the FDA did give an emergency use authorization, which is kind of a preliminary step in these situations. But we do not have them here locally as yet. So I think stay tuned, because those will be coming. But I think that'll help with the treatment of it too.
And there'll be a little more. It's not quite like Tamiflu, where you just take Tamiflu that you usually take for the flu. There are enough drug interactions and other things that need to be taken into account for that. Yeah, I think a lot of people could benefit, but it also be some people that maybe not so much, just based upon some of the medicines they're already taking or other things that are going on. Like, for instance, the one with Pfizer has certain parameters based upon what your kidney function is. So anyhow, your doctor will work with you on that once those medicines become available. Paul, what's your message to folks who need other things like preventative services? They have chronic medical problems that need to be treated. They have other concerning symptoms besides COVID. What's your message to them right now?
Yeah, please don't ignore them. Please don't ignore those things. I know that, well, my firm belief is that we are seeing maybe the last big, I hate to call it a surge, but the last big tidal wave of cases. And when we get through this, and hopefully it's not going to be too much longer, we'll start to see the pandemic truly shrink. But our concern all through this has been the important screening tests and monitoring of chronic diseases like diabetes and heart disease, that those things have gotten sidelined and put on the back burner. And we know that without careful screening testing and follow-up of those chronic diseases, those things can come back and become a major problem. We're starting to see that a little bit in the incidences of our cancers that are being diagnosed and how severe they are, where in the past we would find cancers very early, and now we're finding them more late stage. That's something we'll have to work through. But in particular, with this Omicron numbers that are spiking, you may hear, oh, your doctor can't see you, and it may be because we had to close their office because we needed them to come and help out in the hospital, or we needed their staff. And so your appointment that was necessary and important remains necessary and important, a necessary appointment, but it may mean that it gets delayed a couple of weeks. But please don't give up and say, well, I guess my doctor says I don't need it.
Right.
So I guess my answer is, please don't forget those things. They remain important and will become important even more so the longer that these things get delayed.
Yeah. Hey, so speaking of offices, the CDC and IDPH, there's definitely right now some back and forth about what's the appropriate isolation and quarantine guidelines and that kind of stuff. There's definitely some debate about that right now. But just in terms of what our ask is for what we're directing our medical staff, and also what we're asking our patients in terms of if they have COVID and coming to our offices, where are we at with that, Paul?
Yeah. So I don't know about you, Bill, but I am have fatigue over the new guidelines. Mask, don't mask, stay home, don't stay home, school's in, school's out. It's fatiguing and it's confusing. I guess I try to look at things from a common sense approach. What makes sense? What do we know about infectious diseases? Let's go back to the basics and try to appeal to people's common sense. What we have been working with is the assumption of if somebody is sick, they are probably contagious for probably 10 days. In some cases, it might be less. In some cases, maybe a little more. But by and large, what we are seeing is that people are generally no longer considered contagious after 10 days. So I know that there was a recent guideline that said if you wanted to quarantine for 5 days, and then after that, you could go out with a mask and wear the mask for 5 days. I'm not sure where they're going without a mask unless they're outdoors, which is fine. What we are doing with our physician clinics is we're asking people that if you have COVID, is that you stay away for those 10 days and give yourself a chance to heal. Give us enough time so that we know that you're no longer contagious, and then absolutely want to see you after that 10 days if you need to be seen. But again, the guidelines are very confusing, and I think we should stick to what we know and ask for people to give us 10 days so that we know that they're no longer contagious, and then we want to see them.
And in the interim, we do have telehealth visits and those type of things where we can interact with you and everything too. So good. I just want to make sure we talked about that. 2 other questions, and then I'll let you go, Paul. First of all, just if you would speak about the visitation and policy and stuff like that, where we're at here at the hospital.
Yeah. So I still consider the hospital safer to go to than the grocery store.
Sure, for sure.
Because of what we're dealing with. Our visitor policy really has not changed, but we are asking that if you don't need to be here, it's probably not smart to be here. So we still allow if you bring grandma in or grandpa and he needs a caretaker, then you need to come in with grandma or grandpa. If you're coming in with your child, obviously that you need to be there. But this is not a social gathering where I'm gonna go to the doctor appointment with my friend, and then we're gonna get lunch. That's not what our visitor policy is about. So we're really trying to limit the hate to call it this, but the unnecessary people that are in the hospital or the clinics. So again, our visitor policy really hasn't changed much, other than to ask that people be really prudent about whether or not you need to be here with your loved one or a friend.
Yeah, I guess I had 3 other questions because I see some of our viewers are asking a little bit about gathering and celebration recommendations and those type of things.
Yeah. So again, I'm gonna go back and say, you know what? I trust you all. I trust our population and our community, and I'm asking them to employ some good common sense. So if you are vaccinated and you've been boosted, and you're going to have a small gathering with people that are vaccinated and boosted, I think that sounds very appropriate. Does it make sense if you're unvaccinated to be going to a crowded bar for 4 hours with poor ventilation and doing that kind of stuff? That doesn't seem like common sense to me. So gatherings and celebrations, I think, again, use some common sense with that. That's my comment about it.
Okay, good. So final question. I just wanted to have an opportunity to talk about any comments on the job our CGH healthcare team is doing in terms of presently right now with this Omicron situation, as well as how they've been doing throughout the course of this pandemic, Paul.
Yeah. So I guess there's a couple ways I can answer this. I want to start by thanking our CGH team, our employees, the folks in particular that are out there every single day at the bedside, taking care of not just our COVID patients, but all the other patients that we have. People are tired and burnt out, and yet they show up for work, and they show up with heart, and they show up with compassion, and they keep doing it. So for those folks, the community owes them a great debt.
Agreed. Yeah.
So it's not just those folks though, and again, they're on the tip of the spear, but it's all the other people that are supporting that endeavor. So I think about our people that work in the cafeteria. They're helping feed the folks that are doing it. I think about people in the plant operations. They're keeping the building going and keeping the sidewalks salted and all that. There's a psychological aspect of coming to work every day. In some of these cases, it's very futile, and it's hard to know that you're going to take care of somebody for several weeks and not know the outcome of how that's going to go. And we're 21, 22 months into this. It is normal, I think, to be burnt out and tired. And I also know that I think we are beginning to see the light at the end of the tunnel. It doesn't seem like it right now when our Omicron numbers are so large, but it is going the way that pandemics go. If we could find folks that lived through the Spanish flu of 1918, we probably could have a lot of similar stories, and we will get through this, and we are getting through this. I think we're beginning to see the end of it. It doesn't feel like it some days when we come in. We hear about more and more people in the hospital, and as Omicron has been so much more contagious, it ends up impacting more and more of our employees, which makes our workforce even thinner. But I want the community to know that we are here and we are on our watch, and we're doing our very best to take care of the folks that need it. So rest assured, we have very dedicated people doing their very best to help all of us through this, and that has not faltered.
Oh, thanks, Susan. Appreciate that. Yeah. Okay. Well, hey, we probably should wrap it up. We've done our good 35, 40 minutes of talk. Oh, appreciate that, Donna. So for all of you who have had the chance, who have taken the time to listen and hear what we this interview, thank you so much. Thanks to our community for supporting us, and just thank you very much. And Paul, thanks so much for taking the time to answer some of these questions. And for our community and for our CGH team, thank you. And hey, stay safe, and we'll be back next week. Thanks.